We're switching gears now. Lung cancer is becoming more common among young, healthy women. The CDC says up to 20% of new diagnoses are now found in people who've never smoked. Dr. Christine Lovely is the division chief of Thoracic Medical Oncology at City of Hope, and she's here to talk about what's driving up these cases. Thank you so much for being with us this morning, Dr. Lovely.
Thank you so much for having me this morning. It's a pleasure to be here.
Yeah, this is very fascinating. So lung cancer is the second most common cancer in both men and women, but why are we seeing this increase in younger women, which is so scary?
Yeah, it's the second most common cancer in men and women, but I would say it's the first most common cancer cause of deaths in both men and women in the United States. And I think a lot of people don't appreciate that. Why is it so common? People historically relate lung cancer to smoking, but that is absolutely not the only cause of lung cancer. And we're all at risk for lung cancer, and there are many potential risk factors. Tobacco smoking, secondhand smoke, radon exposure, air pollution, asbestos, many different things that actually put us at risk for lung cancer.
Yeah, but as you said, common for most people is to think if I didn't smoke, then I probably don't have lung cancer. So what are some of the early signs that you have lung cancer, especially for non-smokers?
Yeah, and one of the challenges is the early signs are pretty not specific. A little bit of chest pain, cough, things that can be due to many different factors. Chest pain, cough, maybe a little bit of back pain, joint pain, very not specific. So take these symptoms very seriously if you experience chest pain or cough.
And then if environmental factors are at play here, as well as smoking, as we talked about, and that's associated with this rise in cases, should there be new screening guidelines, or are there certain areas of the world or the country that are more prone to developing lung cancer?
Absolutely. So there is not a one-size-fits-all approach to lung cancer screening right now. The current guidelines are for patients who have a history of smoking, at least 20 pack years, who are 50 to 80 years old. That clearly is only a very small population of patients. So we need different lung cancer screening guidelines for those patients who are never smokers, who are very light smokers. This is a very active area of research and an urgent area of need.
Absolutely. So younger patients who are hearing this and now concerned about their cancer risk, how do they advocate for themselves? How do you go to the doctor without being ridiculous, but you want to be aware that this is a potential?
Yes, I see many patients in their 20s and 30s with lung cancer, often that has spread beyond their lungs at the point at which they're diagnosed. Take your symptoms seriously. If you're experiencing chest pain, cough, shortness of breath, talk to your primary care provider, talk to your physicians, ask for chest x-rays, ask for CT scans. This is increasing across our country. There is an urgent need to help promote lung cancer awareness. Please do not ignore these symptoms.
And is there anything you can do to try to help prevent this if you know you live in an area where air pollution is a major problem, or you know you've been around someone who smoked, you were exposed to secondhand smoke when you were young? Can you reverse that?
Yes, it's difficult to reverse it, but I would say one easy thing for patients or people to do is have their homes checked for radon. This is something you can do for your homes. There's different levels of radon across different parts of the country, but you can have your home checked for radon, and there are radon mitigation systems that you can actually put into your home.
Okay, definitely good to know. Dr. Lovely, thank you so much for being with us this morning.
Thank you so much for having me. Have a good day.
You as well.